As far back as 2015, a study showed that 35% of transgender Ontarians seriously considered suicide that year, and that access to gender-affirming care can significantly reduce that risk.
It's incredibly important for people's mental health to be able to get these surgeries, to be able to live in their bodies as they see fit.
Amelia Smith underwent a vaginoplasty in 2021 at the Women's College Hospital in Toronto that runs the first publicly funded transition-related surgery program in the country and the only one in Ontario.
The surgery can really be life-saving for people. Gender dysphoria can cause a lot of internal distress, and we know that people may even commit suicide if they don't have access to the care they need.
They do have a significant effect on people's lives. I know that my life has been changed significantly.
Before the Women's College Hospital launched their program in 2019, patients had to get gender-affirming surgery either privately or out of province.
For a lot of patients, they're not coming from very high socioeconomic backgrounds, and it can be really hard for them to travel, to take time off work, and to pay privately for these surgeries. And so bringing it into the public sphere where the surgery is funded, and they also are having their care close to home, and so they don't have to take as much time off work. They don't have to pay for the travel.
This program deserves more funding. With more funding, they can reach more patients.
This bill, of course, is being introduced days before Trans Day of Remembrance on November the 20th.
MPP Kristen Wong-Tam recently introduced a private member's bill to establish a gender-affirming healthcare advisory committee in hopes of improving access to such care, and called for it to pass by unanimous consent.
Every Ontarian should have access to appropriate health care that is life-saving, that is life-affirming. This bill has been seen in the House before, and this House needs to take action today. We need to ensure that every member of the House truly supports that trans healthcare should not be up for debate. Anything less would be transphobia. Delaying the passage of this bill will cost trans Ontarians their lives.
The motion to pass the bill by unanimous consent was denied today, but it still could be called for a second reading in the House. In response, Wong-Tam said in a statement, passing this bill would be the first step in reversing a healthcare system that has long abandoned two-spirit, trans, intersex and gender-diverse Ontarians. If Doug Ford and the Minister of Health were serious about fixing the healthcare system for everyone, they would not have delayed this bill's passage. The Ontario Ministry of Health did not respond to CityNews' request for comment by airtime. For City News, I'm Dilshad Burman.